And now, please welcome to the stage Priscila Canizares, Daphne Jackson Fellow at the Alan Turing Institute.
How does it work? Next. Thank you. Hello, everyone. I'm Priscila Canizares, a Daphne Jackson Fellow at the Alan Turing Institute and University of Cambridge. And today, I would like to talk you about multi-scan or multimodality imaging to aid clinical diagnosis. This is a direct application of machine learning to science. Probably most of you have got more than one scan taken along in your life. There are healthcare scans that are taken routinely, like X-ray, MRI, positron emission tomography, or ultrasounds. All these different scans are based on different physical processes in order to visualize different anatomy of the body and different tissues. So depending on the condition, medical healthcare can tell you which kind of a scan is suitable for understanding what is going on with you. Usually, there is one type of a scan you will have taken, but if the healthcare or the medical doctor decides that you want to have a CT for a quick check, which low-dose CTs are very common nowadays, and then they find something suspicious, they might ask to have a different scan, for instance, an MRI or a positron emission tomography. These different scans visualize different types of structures. One can study basically the anatomy, and with a positron emission tomography, you can see, for instance, blood flow or molecular absorption. Then, by combining different scans, medical doctor can have a better idea what's going on and perform a better diagnosis. This is mostly the focus of this talk. So how does it work? When you're going to have one of these scans, usually we'll find a machine like that, which is called a scanner, and the patient will be set on the bed, and you will be inside the scanner. So what happens is that the scanner has different detectors all around you, and this will take different projections of the detection in your body and make and form an image, what is called a cyanogram, we can see in the left of this computer. To go from this cyanogram, which is what the machine actually gives to you, to an image, you need to apply different mathematical algorithms and computational techniques in order to reconstruct the image from this cyanogram. However, this is not as straightforward as you might think. When you detect the scanner measurement, this scanner measurement comes with noise. This noise it can be due to different sources. For instance, the detector itself can be noisy, or the patient may be moving. If you are dealing with children or the elderly, it's very challenging to get them still for a long period of time. So then the reconstruction is what we call in mathematics an ill-posed or ill-conditioned inverse problem. So how we deal with these problems, how we can get an image that can be useful for a clinical diagnosis. So to go with this theme, what we are doing is apply mathematical techniques, in particular what we call prior information or regularizers, to extract the noise, or basically may have a better reconstruction of the image. This is mostly given by prior information. This prior information can be, for instance, information about the smoothness. So you are not expecting to have a square kidney or a triangle for a heart. So basically, you're looking, you are driving your algorithms to find for the smoothness. Another technique, which is the one that I'm looking at, is using an alternative scan. So basically, you mix together information from different scans. In this example, we have got an MRI and a CT. Both of them have their shortcomings. The CT usually is a low dose because you don't want to irradiate the patient a lot. And the MRI can be undersampled. But combining them to guide one image to reconstruct the other, you will have like a third modality of image, with more information content than the original ones. In this way, we are going to have a better reconstruction. This has given very excellent results in practice, but it has got some shortcomings. On the one hand, you don't have two scan stakes at the same time. You usually have one, and if the practitioner thinks that is convenient, you'll have another one at a later stage. So this is basically the main problem. The second one is that this is a handcraft. You need an expert to handcraft this prior information, to put these regularizers inside your mathematical model, and basically actualize what you are seeing and reconstruct an image. And finally, this is very computationally expensive. So all this together made it difficult to deploy into a clinical setting. This is where work comes into place. So what we are doing is basically construct this prior information, this regularize it using machine learning and artificial intelligence. That means that we can replace this piece that has been introduced in your mathematical model with a machine learning one. How we are doing this? So basically, we look into a bank of patients, a bank of scans that have been taken and stored, and we build a synthetic MRI, in this case, in order to use with your mathematical model and reconstruct your CT. So putting all the pieces together, what you are doing is building a synthetic CT, a synthetic MRI, that you can store, and then at the end of the day, the medical doctor just will need to use one single scan in order to have all the information that they need to make a proper diagnosis. So this is basically what we are doing at the moment. Most of the main takeaways that I would like to get home today is that there is a way to combine classical techniques, classical mathematical techniques, with machine learning in order to get the most of both worlds. The properties of well-posedness and convergence that are giving you good results using classical techniques, but enhanced with machine learning. And in this case, in this application, we are able to do that and provide a way for clinical doctors to get just one scan and obtain all the most information that they can have and provide a better healthcare. Thank you very much.